Well, hello there. Welcome to the Hurtin' Hippies rendition of Consumer Information Health Canada. Yeah, having a little fun here. I thought I'd share with you all what our government currently says about marijuana. Remembering, because I don't want to chastise our government too much, although I hate our government, um, and I hate all government. I think I got to give them a little bit of a leeway on the reading of this because I not only do I find it funny, but I do think that some of this may change with recent changes that have been forced upon the government by our courts. But I still find it funny. So, this may take a little while, and I'm not going to read it all. I promise you, I'm not going to read it all. Uh, it is Consumer Information Cannabis. The early ones of these did not say the words cannabis. Now they put marijuana and marijuana in, because we have to do French and English, in brackets. They used to just call it marijuana, so it's nice to see them moving away from that. The courts in Canada have ruled that the federal government must provide reasonable access to a legal source of marijuana for medical purposes. The production of marijuana for medical purposes by individuals is illegal. The only source of marijuana for medical purposes is from a licensed producer. That is one rule that has been ordered to be changed. A complete list can be found on the Health Canada website. Marijuana is not an approved therapeutic product. For the provision of this information should not be interpreted. And the provision of this information should not be interpreted as an endorsement of the use of marijuana for therapeutic purposes or of marijuana generally by Health Canada. Disclaimers, eh? The leaflet is designed by Health Canada for patients authorized to possess dried marijuana, fresh marijuana, and cannabis oil for medical purposes. It is based on the document Information for Healthcare Professionals Cannabis and the cannabinoids, and is a summary only, and it will not provide you with the facts about marijuana with all the facts. Consult your healthcare practitioner. But they don't teach their healthcare practitioners. Consult yourself. And that's what I'm going to do as we read through this is I'm going to make a few little comments as we go along. And I'm not going to, as I said, I'm not going to read it all, but I think it's fun. Next part, serious warnings and precautions. Keep any fresh or dried herb, marijuana, cannabis oil out of reach of children. Yes, of course. Cannabis, they keep putting in brackets marijuana, contains hundreds of substances, some of which can affect the proper functioning of the brain and central nervous system. The use of this, I should stop because it just came. Serious warnings and precautions. Keep that in mind. Think of this as a fear propaganda. This is not an information packlet. This is fear mongering to try to kind of the last step. Okay, we're sending you the marijuana, but please read this and maybe you'll go back to pharmaceuticals. Next one. The use of this product involves risk to health, some of which may not be known or fully understood. That's good. That's backing you. That way you don't have to put any citation. Studies supporting the safety and efficacy of cannabis for therapeutic purposes are limited and do not meet the standard required by Food and Drug regulations for marketed drugs in Canada. The reason the studies don't meet those standards is they aren't allowed to meet those standards because of the poor classification of marijuana as a drug instead of a medicine. Smoking cannabis is not recommended. Do not smoke or vaporize cannabis in the presence of children, of course. Just as, in fact, that's twice they've said that now. See what I mean? They sneak these in. The very first one was keep it all out of the reach of children, and then it says do not smoke it in front of children. Well, but still, it is using cannabis or any cannabis product can impair your concentration, your ability to think or make decisions, and reaction time and coordination. This can affect your motor skills, including your ability to drive. It can also increase anxiety and cause panic attacks, and in some cases, cause paranoia or hallucinations. I love how they keep trying to say marijuana causes hallucinations. The only hallucination I've ever had from marijuana is sometimes when you have a bad cough or a really heavy toke that hits you a certain way, you, whether your eyes are open or not, you get black and you get some lights and stuff like that. That is a reaction. It's not a hallucination. You're not going to see pink elephants running down the street. And the last one, cognitive impairment may be greatly increased when cannabis is consumed along with alcohol or other drugs which affect the activity of the nervous system. Example, opioids, sleeping pills, other psychoactive drugs. Well, yeah, another one that's kind of duh. Then they go on about this product and they tell you what cannabis is, and it only tells you in this first paragraph on the first page, right up there, is, oh sorry, I had the wrong page there, about this product. I have some notes along these lines, so I'm going to go straight forward. Because they say, what may this product be used for? It's a may. And then they list deadly diseases, cancer, HIV, and maybe others. It's kind of stupid. And then what the active ingredients might be. That's a title. What the active ingredients might be. Not what are the active ingredients. What they might be. What kind of a factual information sheet says this might be there? THC and CBD. That's what it says. The type and amount of these ingredients may vary depending on the cannabis strain. Then what other ingredients might be? There are over 70 cannabinoids as well as hundreds of other chemicals in cannabis. Fear-mongering. Many of the chemicals found in tobacco smoke are also found in cannabis smoke. That is a sneaky little... Let's sneak that in there and scare people again. Yeah, and you know what? A lot of what's in tobacco smoke is in chimney smoke and smoke from your fireplace and smoke from your barbecue. Carbon monoxide, carbon dioxide. The smoke exhaled or inhaled is smoke. But they want to scare you. Then it goes on to say what the product does, and I'm not going to read that because it's just kind of stupid. It just says that it talks about cannabinoid receptors, but at such a high level that nobody would really understand it. When the product should not be used, and the very first, they have some bullet points here. And I do agree with some of it, and I disagree with some of it. Cannabis should not be used if you, and the first bullet point, are under the age of 25. Wrong. 100% wrong. In fact, I say the other. I say we really need to look how our young people could benefit from better development of their brain, their body. It doesn't hurt the brain or body, it develops the brain and body. But that's fear-mongering. And then it says if you're allergic, of course, have serious liver, kidney, or heart disease, you shouldn't take it. I don't know why there. I had liver disease, and this helps me. Personal family history of serious mental disorders such as depression or bipolar. Wrong. Cannabis works beautifully. In fact, recent studies, and I've shared them on Weedy Weekend, anybody can look back, have shown that cannabis is incredible at depression, and they're now realizing it can work on many mental disorders. Uh, shouldn't use it if you're pregnant, it says here, which studies are starting to say maybe you should. And I underlined this one. You shouldn't use it if you are a man who wishes to start a family. Ooh, it'll take all your sperm. No! No, it won't. I've smoked it all my life. I have 4 kids. And my youngest is 7. I'm 54 and I got a 7-year-old. No, it doesn't take that away. And I won't go further into that. Then it goes on with some. It speaks pretty good about the. It doesn't say anything about the interaction except for it deals with the nervous system. And then in dosing, it speaks well about the fact that we don't know enough yet. It says because there aren't enough studies. It doesn't say because we won't let the studies happen. But it does say real good that people have to use titration. They have to use their own titration. And titration is the act of finding the right dose level that is strong enough to attack the symptoms while not overly strong to over impair. They call it differently. That's the way I say it. They do say something pretty good here. There are a small number of chemical studies of short duration with smoke vaporized cannabis for therapeutic purposes. Smoking vaporizing cannabis result in more rapid onset of action within minutes, higher blood levels of cannabinoids, and a shorter duration of acute effects compared to oral ingestion. While there are no established dosing guidelines for smoking vaporizing cannabis for therapeutic purposes, it's prudent to proceed slowly and cautiously in a gradual fashion, taking somewhere up to 30 minutes between puffs. And on dosing about oral, they say a couple hours between eating. And they're right. That's some good information. It's information that I've always shared with any of you new users out there. Some of you that follow me are brand new to it. You know, there were people in the doctor's office today, and there was an old man. He was probably 75, and he was having trouble with his vaporizer, and he really wanted to get onto oils. And so there are people who are using this, and we're all guinea pigs. So that was some good information. But then they go on. In contrast to smoke vaporized cannabis, there are no clinical studies about edibles. And they're wrong. There are studies. They just don't support those studies, so they won't talk about those studies. Especially when you talk about RSO, Rick Simpson oil, and those kind of things. There's some really good case studies that can be used to understand and even understand dosing. I would say even more so, edibles have come a long way in a year. A year ago, I couldn't advise you on dosing. Now with edibles, most edibles carry the milligram content of THC in it, of active cannabis, and thereby how high it will make you, and thereby you can determine really low dose is a 10 milligram, a fair beginning dose is a 20 or 25 milligram. Regular users can go between 40 and 60. If you're got high tolerance, 100 milligram or more isn't too bad. Don't go above 200. That kind of thing. See, that's some really accurate information that they don't share here. And then I go on to the next page, which I gotta show that. Overdose, and I put beside it ha ha, and then wrote over it wrong. So this is worth a reading. Let me first say, to truly overdose on marijuana, you need 1,500 pounds of dried product and it has to get into you within 15 minutes. So no matter how much you concentrate that down, the best concentrates, bring it down to about 10%. So 1,500, 150 pounds of concentrate in 15 minutes. Absolutely impossible. Can't even inject it into your body that quick. That's just too much product. Impossible. So for them to talk about overdose, they should really say that. There is many studies that support that. But they don't. They go, symptoms of overdose may include sleepiness, confusion, disorientation, clumsiness, loss of coordination. So far, I'm overdosing. Fainting. Oh, okay. Dizziness, chest pain, fast, slow, or pounding heartbeat. Which, fast, slow, or pounding? Well, if it's pounding, it's working. If it's going fast, you may have ran. If it's going slow, you may be sitting. I mean, come on. Panic attacks, loss of contact with reality, and seizures. I have never, in 43 years of smoking and taking cannabis, seen anybody have a seizure from cannabis. A green out isn't a seizure. A green out is lying on the bathroom floor saying, I shouldn't have had that beer with that joint. Then they say, seek immediate medical attention in case of overdose, especially if experiencing chest pain, panic attacks, loss of contact with reality, or seizures. Well, yeah. Cannabis should be used with caution in patients receiving concomitant therapy with other psychoactive drugs because of the potential for greatly enhanced effects of the brain and other parts of the nervous system. An overdose can occur if a patient is smoking, vaporizing cannabis at the same time consuming orally administered cannabis. No, it can't. It's saying that if you smoke and eat at the same time, you're going to overdose. No, if you smoke while you've eaten, you're going to get extremely high. We're 17 minutes, but I'm having fun with this. I hope you are too. I really do. Side effects and what to do about them. And, I put beside this, scared yet? Again, this is where I felt they're trying to scare people. This is their last attempt at scaring you out of taking medicinal cannabis. The information on side effects associated with therapeutic use of cannabis is limited. Then they go on. Some of the more well-known side effects are intoxication-like reactions, including dizziness, drowsiness, feeling faint or lightheaded, fatigue, headache, impaired memory and disturbances in attention, concentration, and ability to think and make decisions. It actually helps me make decisions. Disorientation, confusion, feeling drunk, feeling abnormal. Come on, what kind of words are these? This is not information, this is fear. Or having abnormal thoughts. What is an abnormal thought? Feeling too high. Feeling of unreality. I don't think unreality is a word. Feeling an extreme slowing of time. It isn't telling you what to do about them. Suspicion, nervousness, episodes of anxiety resembling a panic attack, paranoia, loss of contact with reality, hallucination, seeing or hearing things that do not exist, impairments in motor skills and perception, altered bodily perceptions, loss of full control of bodily movements, falls, dry mouth, throat irritation. I had the toke ready for this. Hang on one sec, because this is just too effing funny. See, I try to keep it for the young people. What I've gotten there is a little bit of rosin made from sweet skunk CBD, which is a CBD rich version of Sweet Island skunk. on top of platinum bubba. So sativa on top of indica. Let's go on. More of the side effects. Dry mouth, throat irritation, coughing. Worsening of seizures. If you're taking it for seizures and it worsens your seizures, you're not taking it for seizures. These things are not thought well out or read by anybody. Nobody in Health Canada proofed this that has ever smoked. Hypersensitivity reactions, contact dermatitis, hives. Unusual. I've never heard of anybody getting hives, but people may have reactions. Higher or lower blood levels of certain medications. Doesn't even make sense. Nausea, vomiting, and fast heartbeat. They've said it again. Then they go on to say long-term use may increase the risk or triggering of aggravating psychiatric and or mood disorders. So again, long-term, it may cause depression. Increase the risk of developing respiratory infections or coughing. Decrease sperm count. I have not heard of that, but they keep trying to say it. If any of you know anything about that, because I don't buy it. One thing they say is right, may lead to a decrease in one or more of the effects of cannabis over time. Tolerance. Yes, long-term use may create some tolerance. So that's it. This whole thing reproduced every time a LP sends marijuana to a patient. Has to be printed, sent to them, for them to throw away. This is the first time I read it because it was silly and I wanted to get through it. I hope you enjoyed it. I hope our government, now that they have been ordered to become prudent about looking after the people, the patients, rather than applying stigma-based decisions. It was very clearly said by the judge that most of the decision makers here knew little to nothing of what they were making decisions of. Now we have better people. We actually have a doctor at the head of this. Let's get some proper stuff out there. Let's get some proper stuff to the people who are getting this. If I were an old person, I am an old person, who just received this in the mail, my first delivery of cannabis, and I opened that up, and I've never smoked it in all my life, but my doctor said I need it because I got cancer. And I'm reading through that. That's the paperwork's going to give me the anxiety, not the marijuana. Shame on the government. They got to do better. Peace, cheers, love and harmony.